Hey everyone, and welcome back for another deep dive with us. Today we're going to be tackling something that you're going to be dealing with literally every single day as nurses.
Oh, yeah.
Patient mobility and activity.
Oh, absolutely.
We've got a ton of sources here, articles, research case studies, and really our mission is to extract the need-to-know info for you guys.
Yeah, it's one of those foundational concepts, impacts almost every aspect of patient care.
Totally.
From recovery to their overall well-being.
Yeah, and so the first thing that really stood out to me in these materials was just how complex even the simplest movements are.
Right.
Like we take for granted, standing up walking.
Oh, for sure.
But there's this whole intricate interplay of systems going on.
It's fascinating, isn't it?
Behind the scenes.
You've got the skeletal system providing that framework, the muscular system generating the force, and then the nervous system.
Right.
Coordinating and controlling everything.
Yeah, that's not just about the big obvious movements either.
Right.
Even tiny adjustments, like maintaining your balance when someone bumps into you, requires this constant communication between your brain, your muscles, and your senses.
Think about a patient with a neurological condition like Parkinson's disease.
Right.
Those disruptions in the nervous system can profoundly impact their ability to initiate and control their movement.
Oh, absolutely.
Leading to tremors, stiffness, difficulty with balance.
That's a great point.
Yeah.
It makes you realize how crucial it is for nurses to understand those connections between the nervous system and movement disorders.
Absolutely.
We need to be able to assess those subtle changes, anticipate potential problems, and tailor our interventions accordingly.
Absolutely. And it's not just about recognizing the problem.
Right.
It's also about appreciating the incredible resilience of the human body.
Yeah.
Even with those neurological challenges, there's often potential for improvement and adaptation through targeted therapies and rehabilitation.
Now, speaking of adaptation,
I
was really struck by how mobility changes throughout the lifespan.
Absolutely.
The source material had this amazing table outlining developmental milestones from infants learning to hold their heads up to older adults experiencing age-related changes.
It highlights the importance of considering the patient's developmental stage when assessing their mobility and planning care.
For sure.
What's normal for a toddler is very different from what's expected for an 80-year-old.
Right. For example, with infants, we're looking for those key milestones.
Yes.
Rolling over, sitting up, crawling, walking. And any delays could signal potential developmental issues.
Whereas with older adults, we need to be aware of the physiological changes that come with aging.
Okay.
Like decreased bone density, muscle loss, and joint stiffness.
And that can make them more vulnerable to falls and injuries, right?
Exactly. So simple tasks like getting out of bed or navigating stairs can become challenging and even risky. That's why it's so important for nurses to assess the environment, provide assistive devices, and educate patients and their families on fall prevention strategies.
But it's not just about the physical changes, is it? The materials also emphasize the psychological and social factors that can influence mobility.
Things like a patient's motivation, their fear of falling, cultural beliefs about exercise, even their emotional state can have a huge impact.
So we need to be thinking holistically.
Yes.
A patient who's reluctant to get out of bed might not be simply being difficult.
Right.
They could be dealing with pain, anxiety, or even a sense of hopelessness.
And that's where our assessment skills come in.
Right.
We need to ask the right questions, listen attentively, and observe carefully to uncover those underlying factors that might be hindering their mobility.
I remember reading about a 10-year-old girl named Kelsey who's in a coma after an accident. She couldn't tell the nurses if she was uncomfortable, so they had to be extra vigilant about preventing skin breakdown and contractures.
That's a powerful example of how immobility can create a cascade of complications if we're not proactive.
Yeah.
It's like this silent threat that can affect every system in the body, from the cardiovascular system to the respiratory system to the musculoskeletal system.
And the longer someone is immobile, the greater the risk of those complications.
Exactly. That's why early mobilization is so crucial.
Okay.
We need to get patients moving as soon as it's safe and feasible.
Right.
Even if it's just sitting up in bed or doing some simple range of motion exercises.
That brings us to the topic of exercise. something I'm personally passionate about.
Good.
The materials highlighted the different types of exercise and their benefits, but they also stress the importance of safety and individualization.
It's not a one-size-fits-all approach.
Right.
We need to consider the patient's overall health, their physical limitations, and their goals when designing an exercise plan.
For example, someone recovering from surgery might benefit from gentle range of motion exercises to prevent stiffness and improve circulation, while someone with COPD might need modified exercises that focus on breathing techniques and energy conservation.
And it's not just about the physical benefits.
Right.
Exercise can also have a profound impact on mental health, reducing stress, improving mood,
Wow.
and even boosting cognitive function.
So it's a win-win.
Absolutely.
But before we get too carried away with the benefits, we need to remember that exercise can also carry risks.
Yes.
Especially if it's not done properly.
That's why medical clearance is essential,
Okay.
especially for patients with underlying health conditions.
Right.
We also need to teach patients how to exercise safely, emphasizing proper form, gradual progression, and the importance of listening to their bodies.
And we need to be mindful of our own safety as nurses.
Oh, for sure.
Lifting and moving patients can put a lot of strain on our bodies. So using proper body mechanics and assistive devices is crucial.
Absolutely. Back injuries are a major concern in nursing, so we need to be proactive about protecting ourselves.
Right.
That means using those gait belts, lift devices, and other tools that are available to us, and not hesitating to ask for help when needed.
Teamwork makes the dream work, right?
Absolutely. We're all in this together.
We are. But before we jump into the practical aspects of assisting patients with mobility, I think it's important to take a step back and consider the emotional impact of immobility.
You're right. Imagine being confined to a bed.
Yeah.
Unable to do the things you once took for granted.
Right.
It can be incredibly frustrating, isolating, and even depressing.
So it's not just about getting patients physically moving.
Right.
It's also about supporting their emotional well-being.
Exactly. We need to be empathetic listeners, validate their feelings, and offer encouragement and support.
Yeah.
Sometimes just a kind word or a gentle touch can make a world of difference.
And we need to remember that every patient is unique with their own set of challenges, fears, and aspirations.
That's why individualized care is so important.
Okay.
We need to take the time to get to know our patients, understand their perspectives, and tailor our interventions to their specific needs and goals.
Sounds like there's a lot to consider.
There is, but I think the key takeaway here is that promoting mobility isn't just a task on our to-do list.
Right.
It's a fundamental aspect of nursing care.
Absolutely.
That can profoundly impact a patient's recovery, well-being, and overall quality of life.
This has been such a great start to our deep dive into patient mobility. We've covered a lot of ground, from the basic physiology of movement to the emotional and social factors that can come into play.
And we've only just scratched the surface.
Exactly. In the next part of our deep dive, we'll delve deeper into the practical aspects of assisting patients with mobility.
Yes.
Exploring specific interventions, techniques, and assistive devices. So stay tuned. Welcome back. I'm ready to get into the nitty-gritty of how we actually help patients get moving. We've talked about the why of mobility. Now let's tackle the how.
I like the why and the how.
Yeah.
And, it all starts with a solid understanding of positioning.
Okay.
It might seem basic, but proper positioning is essential.
Right.
Especially for those who are bedridden or have limited mobility.
You mentioned positioning in part one, but why is it so crucial?
Well, think about it.
Okay.
When a patient is lying in one position for too long, pressure builds up on certain areas.
Okay.
Particularly bony prominences like the heels, elbows, and sacrum.
Right.
That can lead to pressure ulcers, which are not only painful, but can also become infected and delay healing.
Ouch, that sounds serious. I remember learning about pressure ulcers in class, but it's different hearing about it in this context.
And it's not just pressure ulcers.
Okay.
Prolonged immobility can also lead to contractures, which are basically a shortening of muscles or tendons that restricts movement.
Okay.
Imagine trying to bend your arm after it's been stuck in a cast for weeks. That's similar to what can happen with contractures.
Okay, that makes sense.
Yeah.
So by changing positions frequently, we're essentially distributing that pressure, allowing the skin and tissues to breathe.
Exactly.
And keeping those muscles and joints from stiffening up.
Precisely. And there are specific positions we use to achieve this.
Okay.
You've got the supine position where the patient lies flat on their back.
Right.
The side lying position where they're on their side with pillows supporting their limbs. and even the prone position, which can be helpful for improving lung function in certain patients.
The prone position, that's the one where they're lying on their stomach.
Yes. Exactly.
Okay.
It can be particularly helpful for patients with respiratory issues because it helps open up the airways and improve lung expansion.
Okay.
But it's not suitable for all patients.
Right. Yeah.
And we need to carefully assess their individual needs and risks before placing them in this position.
That's a good reminder that we can't just apply these positions blindly. We need to think critically about each patient's situation and choose the position that's most appropriate for them.
Absolutely. It's like a puzzle.
Yeah.
We need to consider their medical condition, their level of mobility, their comfort,
Right.
and any potential risks before making a decision.
Okay.
And we need to be vigilant about assessing for signs of skin breakdown or discomfort
Right.
and repositioning them accordingly.
Okay, so we've talked about positioning. What's next in our toolkit for promoting mobility?
Well, once we've addressed positioning,
Okay.
the next step is to actually get our patients moving.
Right.
And that's where range of motion exercises come in. Remember, we touched on this earlier.
Yes, I remember the different types.
Yeah.
Active, assistive, and passive.
Exactly. Active range of motion is where the patient moves their joints on their own.
Uh-huh.
Active assistive is where they need a little help from us.
Right.
And passive is where we do the moving for them.
So for a patient who's recovering from surgery and still weak, we might start with passive range of motion, gently moving their limbs through their full range to prevent stiffness.
That's right. And as they regain strength, we can progress to active assistive exercises where they participate as much as they can, and eventually to active exercises where they're doing all the work themselves.
It's all about meeting the patient where they are.
Exactly.
And helping them progress at their own pace, isn't it?
Exactly. It's not about pushing them too hard or too fast,
right,
but rather about providing the right level of support and encouragement to help them achieve their optimal level of mobility.
And speaking of achieving optimal mobility, let's talk about ambulation.
Yes.
Helping a patient take those first steps after an illness or injury can be so rewarding.
It is.
But I imagine it can also be a bit daunting, especially for new nurses.
It's definitely a process that requires careful assessment, planning, and execution.
Okay.
Before we even think about getting a patient out of bed,
right,
we need to assess their strength balance and any potential risks.
So we're looking for things like dizziness, weakness, unsteady gait.
Yes.
Or any signs of pain or discomfort.
Exactly. And we also need to consider their cognitive status.
Okay.
Can they follow instructions and understand safety precautions? Are they alert and oriented enough to participate safely in ambulation?
That makes sense. We wouldn't want to try to ambulate a patient who's confused or disoriented.
Right.
That could lead to a fall.
Absolutely. Safety is always our top priority.
Right.
And speaking of safety, let's talk about the importance of assistive devices during ambulation.
Oh, yes, the walkers, canes, and crutches.
Right.
I remember seeing those around the hospital during my clinical rotations.
Yeah.
But I never really thought about how to choose the right one for a patient.
Well, each assistive device provides a different level of support and stability.
Okay.
So it's crucial to choose the one that best meets the patient's needs.
Right.
For example, a walker provides the most support.
Okay.
And is often used for patients who are weak or unsteady.
So if we have a patient who's recovering from a hip fracture and still hesitant to put weight on their leg, a walker would be a good choice.
Exactly. It gives them that extra stability and confidence to take those first steps.
Okay.
And as they progress,
right,
we can transition them to a cane, which provides less support,
okay,
but still offers assistance with balance.
And what about crutches? When would we use those?
Crutches are typically used when a patient needs to avoid putting weight on one leg.
Okay.
Such as after a knee surgery or ankle fracture.
Right.
They require a bit more coordination and upper body strength.
Yeah.
So we need to make sure the patient is properly fitted and instructed on how to use them safely.
It sounds like there's a lot to consider when it comes to assistive devices.
There is, but it's important to remember that these devices are just tools.
Right.
The real key to successful ambulation is a combination of careful assessment, individualized care planning, and a supportive and encouraging approach.
We need to be patient, provide clear instructions, and celebrate those small victories along the way.
Exactly. And let's not forget the importance of teamwork.
Oh, yeah.
Nurses, physical therapists, occupational therapists, physicians.
Right.
We all play a role in helping patients achieve their mobility goals.
It's a collaborative effort.
Absolutely.
We need to communicate effectively share our observations,
Yes.
and work together to develop a comprehensive care plan that addresses the patient's physical, emotional, and social needs.
And we need to involve the patient's family and caregivers in this process.
Okay.
They can provide invaluable support and encouragement.
Right.
And they need to be educated on how to assist the patient safely and effectively.
This has been so insightful. We've covered so much ground in this part of our deep dive. From the basics of positioning to the intricacies of ambulation and the importance of teamwork.
Yeah.
But I have a feeling there's still more to explore.
You're right in the final part of our deep dive. We'll delve deeper into the crucial aspects of documentation, patient education, and ongoing evaluation.
Okay.
Essential components of providing high-quality care.
Right.
That truly promotes optimal mobility for every patient.
Welcome back for the final part of our deep dive into patient mobility.
We've covered a lot of ground from physiology to practical interventions.
We have.
But there are a few more.
Okay.
Key pieces to this puzzle.
I'm intrigued. What haven't we talked about yet?
Wow.
That's so crucial for nursing care.
Think about it. We can assess, plan, and implement all the right interventions.
Right.
But if we don't document it properly, it's almost like it didn't happen.
You're talking about the importance of documentation.
Yes. I knew it. I knew you would.
It might not be the most exciting part of nursing.
Right.
But I'm starting to realize just how essential it really is.
It is. It's not just about checking boxes or filling out forms. It's about communicating crucial information to the entire healthcare team.
Yeah.
Ensuring continuity of care and protecting ourselves legally.
So what specifically should we be documenting when it comes to patient mobility?
Okay.
It's not just writing patient ambulated, right?
Right. We need to be detailed and specific.
Okay.
For example, if you helped a patient ambulate, document how far they walked.
Okay.
How much assistance they needed.
Mm-hmm.
Any assistive devices used, and how they tolerated the activity.
Okay.
Did they experience any pain, dizziness, or shortness of breath?
And if they used a walker or cane, we should document which one.
Yes.
How it was adjusted.
Exactly.
And any safety precautions we took, right?
All those details matter.
Okay.
They help paint a complete picture of the patient's progress and guide future interventions.
Gotcha.
And don't forget to document any patient education you provided.
Okay.
What you taught them about mobility, any exercises they need to do, and any concerns they expressed.
So it sounds like we need to be meticulous detectives.
Yes.
Recording every little detail.
That's a great way to put it. Accurate and thorough documentation is our best defense against misunderstandings, errors, and even legal issues down the line.
Okay, documentation is definitely top of mind now.
Good.
What else should we be focusing on in this final stage of patient care?
Patient education.
Okay.
We've talked about the importance of empowering patients throughout this deep dive.
Right.
And education is a huge part of that.
So it's not enough to just do things for our patients. We need to teach them how to take charge of their own mobility.
Precisely. We need to explain the why behind the interventions.
Okay.
Teach them how to perform exercises correctly and answer any questions they have.
Yeah.
Knowledge is power. And when patients understand the benefits and the techniques, they're more likely to participate actively in their recovery.
That makes sense. But I imagine some patients might be hesitant or fearful.
Right.
Especially if they've experienced a setback or are dealing with pain.
You're absolutely right. That's where our communication skills come in. We need to be empathetic listeners, acknowledge their fears, and tailor our education to their individual needs and learning styles.
So if we have a patient who's terrified of falling, we might focus on teaching them balance exercises and fall prevention strategies, making sure they feel confident and supported every step of the way.
Exactly. And it's not just about the physical aspects.
Right.
We also need to address any anxieties or misconceptions they might have.
Yeah.
Some patients might believe that moving will make their pain worse or that they're too old or weak to exercise.
And in those cases, we need to debunk those myths, provide reassurance, and celebrate even the smallest victories.
Absolutely. And remember, patient education isn't a one-time thing. It's an ongoing process. We need to continuously assess their understanding, reinforce key concepts, and adapt our teaching as their needs change.
Okay, so we've got documentation, patient education covered.
Yes.
What's the final piece of the puzzle?
Ongoing evaluation. We can't just assume that our interventions are working. We need to constantly assess the patient's progress.
Yeah.
Identify any challenges, and adjust the care plan as needed.
So it's about being flexible and responsive.
Exactly.
Rather than sticking rigidly to a plan that might not be working.
We need to ask ourselves, are they meeting their mobility goals?
Okay.
Are they experiencing any pain or discomfort?
Right.
Are they using assistive devices correctly?
Yeah.
And if not, we need to figure out why and modify our approach.
It's like a continuous feedback loop where we're constantly gathering information.
Yes.
Analyzing it and making adjustments to optimize the patient's care.
That's a great analogy.
Yeah.
And it highlights the dynamic nature of nursing.
Right.
We're not robots just following orders. We're critical thinkers, problem solvers, and advocates for our patients.
Wow, we've covered so much in this deep dive. It's amazing how much goes into promoting mobility. It's definitely not as simple as it might seem at first glance.
You're right. It's a complex interplay of physiology, psychology, and practical skills. And it requires a holistic approach that considers the patient's individual needs and goals.
I feel like I've gained a whole new appreciation for the importance of mobility in patient care.
Me too. And I hope our listeners have as well.
Yes. I hope this deep dive has sparked your curiosity and given you the tools and knowledge to make a real difference in the lives of your patients.
As nurses, we have the power to help people regain their independence, reclaim their strength, and rediscover the joy of movement.
And that's a truly remarkable privilege. Thanks for joining us on this deep dive into patient mobility and activity.
Until next time.
Keep learning, keep growing, and keep moving.